we've got the company is 100% owned by Community Care. And the company will be run by its own set of directors. So it'll be run as an entity aside from Community Care. And our managing director will be Gerry Lane, who has been involved with the care agency before, who understands the domiciliary service, and who understands the packages of care. She will have, alongside her, another director who will be involved in the administration of the company. And of course, what is fundamental here, Ros, is that the same contract that was previously entered into will be entered into by this company. So the care agency and Carlo Vandera will have an oversight of this company via the contract. So we'll be able to hold them to account via the company in the same way. Therefore, if the service isn't that which we want to provide, we can actually try and push for a better standard of service.
And where will the premises be?
So at the moment, the carers can actually go to Europort to pick up their uniforms, to sign the contracts. As from the 14th of April, we'll have an office available in Europort so that the carers can turn up, pick up their uniforms, sign their contracts, and give us all their bank details. We are currently in the throes of looking to establish a more permanent office. We've got the license agreement almost signed, but I don't want to say anything before it's actually signed, Ros.
Given that this is a service that employs over 200 care workers to deliver over 500 care packages, how big will you say the team will be? And will they all be brought in from other areas of government? And if so, how do you then plug those holes?
Yeah, so the idea is that it's not that nobody's brought in from government. So Gerry, for example, is retired, so she's coming back into the workforce to work directly for the company, and everybody else will not be government employees. There will be management of the company. There will be the administrators of the company who will also be employed directly by the company. And then we will be employing supervisors to make sure that all the care workers are where they're meant to be, when they're meant to be, and that all the service users are happy. Until the idea is to move to an app so that we can have the care workers checking in and out when they go to the different homes. And the idea of that app is that we know that the service is being provided, but also that we know that the hours that the care workers are working, so that we can reconcile all the hours at the end of the month quickly, in order to be able to pay the care workers quickly at the end of the month as well.
Well, that was precisely what Lifecom Care were trying to do, wasn't it? Getting the staff to use the app. So how are you going to manage it?
What we've done is that we've managed the entire process alongside the union. So we've worked alongside with Unite to try and make sure that the care workers are happy and that they're receiving a package which they believe that they can work with. So throughout the entire process, the care agency, Unite, and the care workers and the management of the new company have worked together in order to make sure that we get everyone on board. So last week on Thursday, we organised a town hall with the management of the new company, with the care agency, and with Unite, so that all the care workers could attend and ask us any questions, ask us and the new company any questions that they had.
You mentioned employing supervisors to manage the workforce. Where are these supervisors going to come from? Are these jobs going to be advertised?
So bear in mind that we have to 2P over all of the employees of the current workforce. So there will be some supervisors that are coming in from the previous setup. However, we will be looking to employ our own supervisors, and I imagine that the company will be advertising the roles in the usual course. Remember that this is a company that is at arm's length from government.
Given that it was a £3.8 million contract to Lifecom Care over 3 years, where will this money come from?
It's the same contract. So the contract for Lifecom has an ability to terminate with 1 month's notice, which is precisely what we've done. We gave Lifecom 1 month's notice that we were terminating the contract. And then we are looking to set up a new service. So the contract was mutually terminated 2 weeks ago, so that by the end of April, Lifecom would step away and the new company would come in. So it's the same contract that the new company will be picking up and running with.
Okay, when you announced that Lifecom Care was the preferred bidder last year, you said that this would allow them to be more accountable to the government. So my question to you is, how will community care domiciliary care services be held accountable?
We're looking to enter into exactly the same contract with the new company. So what we are looking to do is that we are looking to be able to hold them to exactly the same standards as we wanted to hold Lifecom to. So the standards will be the same as we originally said were applicable.
And how will the service provider, the new service provider, deal with all those legacy issues? There were concerns with the roster that impacted Lifecom Care. There was problems with the missed appointments, which you've already addressed with the app. There were issues regarding not having a base for the workers for their downtime. Are all those issues going to be addressed?
The company will be having a base for the workers to be able to go to. The company is a Gibraltar-based company with Gibraltar-based management, so the management will be available to the workers. The rota issues and the pay issues that were initially addressed, it is the first thing that we sought to address with the company so that they had a payroll service. So that we ensured that they had a payroll service that they could immediately go to so that these issues wouldn't reignite. The care agency have had long conversations with the management of the company to try and ensure that all of the issues that we saw with Lifecom are not resurfaced again. So alongside the union, alongside Unite the Union, we have engaged with the company managers and gone through the whole list of issues that ensued from Lifecom to try and make sure that nothing of that sort happens again.
Okay, you mentioned in your press statement that you are looking to do as many 15-hour contracts as possible. How many do you envisage out of the 227?
What we're encouraging Community Care Domiciliary Services Limited to do is to try and agree as many fixed hours contract as possible. What we've also tried to encourage them to do is to zone the different care workers so that the different workers come into different areas. So that if, for example, there are service users in Laguna, the same workers will go to Laguna so that they don't have to be running around Gibraltar. So what we've agreed with the union is there's going to be a period of time up to 6 months where the company will see how exactly this pans out and how they can give the contracts out. What we're looking to do is to give fixed term contracts to as many people as we can. So that's what we're encouraging the company to do, so that the care workers have the ability to have fixed term contracts themselves.
You also mentioned that there's going to be training offered to Gibraltarians so that there is a pool of workers to choose from when the need arises. But I mean, surely this is an initiative that could have been taken a long time ago. Why is it taken until now?
Training courses have been offered in the past. What we're looking to do now is that we, as HMDOG, are looking to offer the training course and advertise the training course significantly. We've been made aware that there is a want in Gibraltar for these courses. So what we're trying to do is we're trying to make people aware that we do have apprenticeships, that we do have skills for care courses, that we are running all of these different courses so that people can sign up for them. We have had a big input from people. We have a big uptake from people for these courses, and we're now in the process of interviewing them, etc. But they have been available in the past.
You've promised a smooth transition, but we've heard that before. Why is this going to be different?
Ros, this whole process was about trying to improve the service for the most vulnerable in our community. The easiest thing for us to have done is to have done nothing, but we wanted to have a better service. Unfortunately, that hasn't quite transpired in the past 6 months for numerous reasons that both Lifecom and ourselves have now agreed, and we've terminated the contract and we're moving away from that. We want to provide a better service for the elderly in our community and for all of those that are receiving packages of care. We want to make sure that the people that we're paying to turn up do turn up. So therefore, we are going that extra mile to try and make sure that we have a company that is going to deliver that service. And we will not stop until that quality of service that we want delivered is actually delivered.
And are you confident that this is the setup, rather than going through an external provider, this is the setup that is going to finally deliver the service that the service users want?
It ticks a lot of boxes, Ros. It's a not-for-profit company. It's a company that's set up with the aim of delivering the service, and it's set up by individuals who understand the service and the requirements of the jurisdiction. Therefore, we are very hopeful and very optimistic that this service will be delivered in a better fashion than that has been done to date.